Great. Hi, Jessica.
Hi, how are you?
I'm good. How are you?
I'm great.
Awesome. Welcome to Health Tech with Purpose.
Thank you.
So today we would, like to know a little bit more about you, about SpeechMed, right? So to start with, would like to know a little bit more about you. If you can introduce yourself.
Sure. Hi, my name is Jessica Shin. I am the Chief Growth Officer at SpeechMed. And I got involved in this probably because of COVID. We've all experienced it. But for me, it's very personal in the sense that when we had to go through the pandemic and my father got sick during the earlier parts of the pandemic, and me, I'm his caregiver, and I'm always used to going to all his appointments with him. And he was having heart problems, and the only thing I could do was drop him off in front of the emergency room. I couldn't go in, and I've never felt so useless and helpless in my
Yeah.
life that I couldn't be there with my
Yeah.
father. And so I've known the CEO, Susan Perry, for a long time, and I've known all the great things that SpeechMed is doing. And I said, I have to join this company because there are so many people out there like me who live in multi-generational, multicultural families.
Yeah.
And language barrier and not being there for your family members is some of the biggest impactful things
Yep.
in your
Yep.
life.
Yeah. And it is very interesting because some of the things that you are solving, and as you rightly mentioned, multicultural, and especially language becomes one of the barriers, right?
Yeah.
So tell us a little bit more about SpeechMed.
Sure. So when I talk about language, 1 in 5 of us go home to a family that does not speak English. In addition, only 14% of people in the US are health literate, which means that the rest,
That's huge.
86%,
Yeah.
can't even, have a hard time just reading medical information. And so that's why we created SpeechMed. And something that we think about every day is how are patients supposed to follow instructions that they don't understand?
Yeah.
And so SpeechMed is a multilingual audio platform, and it helps patients read and listen to their
Wow.
health information in the language that they understand best. So don't only think about people who can't speak English, but also some of our older patients who might have visual problems or even literate problems amongst the various populations in the US.
Yeah.
That's who we're targeting.
Wow. And those numbers are astonishing.
Yes.
They are big. You said 84% of the people are
Have trouble with
yeah.
health literacy.
Wow, wow, that's so. Tell us a little bit more about health literacy, and what does it mean, so that everybody understands.
Sure.
Yeah.
So health literacy is, does the patient have the ability to understand their health information so that they can make the right decisions about their health?
Okay.
This could be even something simple as reading a prescription bottle. And one example that we like giving is, let's say you have a prescription and it says take once a day. Seems pretty easy,
Yeah.
pretty simple. Well, our company is based in Miami, and a person who speaks Spanish can read it as take once a day. Once, which is 11. So there was
Wow.
actually a case where this woman saw a prescription bottle said take once a day, and she took take once a day, and she
Wow.
took 11 pills. So something that SpeechMed does is we provide medication reminders. So if she had SpeechMed, she would have gotten only one reminder, take this medicine,
Yep.
as opposed to taking it 11 times.
Yeah, yeah, that is an interesting case study. So you mentioned about your father, and you couldn't help much. Can you, in from a speech med perspective, explain how it would have helped, your father in that scenario?
Sure.
Yeah.
So when my father went to the hospital, one of the things I was really unprepared for was that I would have to send him to the hospital by
Yeah.
himself.
Yeah.
And so I was driving to the hospital. My brother was in the back seat. He was searching through my purse for a random receipt so that we can jot down all the medicine that my dad was taking. So the thing is, a lot of people in emergency situations, they aren't prepared to go to the hospital facility or emergency situation
Yeah.
with the right information or even information to help the provider make the right decisions for the
Yep.
patient. So with SpeechMed, my dad would have had all of his medication information,
Yep.
his dosage. It would have had some more information about his health, and he could have gone in and totally informed the health
Yep.
staff, and they could have provided him the best care
Yeah.
for them. And then there would have been a way for them to contact me so that we could have gone through this process together, even without me there.
Got it. Got it. Yeah, and that's very, very helpful because uh, I believe when you are getting hospitalized, one of the key things is the confidence. The
Yeah.
patient's confidence kind
Yep.
of goes low, and they are kind of bit worried. So there has to
Sure.
be some a way that some of these checks are being made, right?
Right. And for a patient going into a situation, emergency situation, the biggest problem for them is, can I trust these
Yeah.
people to
Yeah.
take the best care
Yeah.
for my health? So instead of that, what we're doing is we're empowering the patient so that they understand what's going on
Yeah.
with their health.
Yeah, yeah. So, help us understand what's the journey if a user wants to use SpeechMed. How do they get access to the application? Is it from the provider side, and how's the overall journey?
Sure. So it could be two ways. We will work with healthcare organizations who want to provide speech med for their patients. So if they have maybe a large multilingual population and maybe a population that's marginalized or could use extra help, we would love to work with organizations like that so that they can provide speech med for their patients. We also have an Android version of speech med, so they can download it from the Play Store. It's free, but we do have some features that are, behind a paywall.
Okay. Okay. And so basically it is a B2B2C in a way, and for Android you can directly download from the Android store as well.
Yes.
Right?
Yeah.
Interesting. And how's the journey? So do I sign up, and how do I start using it? So for example, if I got the application, right, what are the steps that user has to follow, and how easy it is to kind of start using the application?
Yeah, sure. So come in through a health provider. One thing we did to make that workflow really simple for the patient is we've partnered with InterSystems. So now we can integrate with over 180 different EHRs. And so the patient information is automatically populated into the SpeechMed app. In addition, there are features where the patient can upload some of their own information on there. Most Medicaid or most health information might not capture the fact that you're taking multivitamins a day. Yeah. So the patient can plug that into the app. If they are just downloading the Android app, they can sign up through the app, and then we also have a patient portal, so they can use the same username that they use to sign up. Go to live.speechmed.com, and from there it's really easy to populate. Just have some of your insurance information, maybe some important documents you'd like to have with you at all times. So it could be a living will, maybe some end-of-life instructions, your latest blood work, your COVID vaccine card. You can upload those type of things on there.
Great. So it also serves as a repository for some of your key documents.
Yep.
That might come handy if needed be.
Sure. And you can also plug in maybe your diet, your allergies, maybe previous surgeries, different things that you've had on there.
Yeah. So does this information then go back to the EHR?
No, it doesn't. Right now, it's all one-sided because you need different permissions depending on the information you're pushing back to the organization.
Okay, that's interesting. So, can you tell us a bit more about your partnership with InterSystems and what they are looking at?
Yeah, so they've been a great partnership for us, and they're one of the biggest database data providers out there. Lot of EHRs that you don't even think about run on top of the InterSystems ecosystem. So we're really so thankful that they have created a partnership for a company like us so that we can help people, make it easy for patients to have their information. And through SpeechMed, now they can read and hear their information in different languages.
Yeah, that's interesting. Can you, as going to come to that point, can you explain a little bit more about the hear part? Because that's I think one really interesting point.
So I think in the U.S. medical system, we expect patients to read and read really well in English. And think about a discharge instruction. Um, they give you 15 pages of paper and you take it home.
Yeah.
But some people are more comfortable hearing their information and they might have trouble reading health information, which is usually written in a 10th grade level. And most people might communicate better a 5th grade level. So what we do is it just helps to enforce some of the information. It might be older patients or patients with um, visual impairments,
Okay.
just to be able to hear the information. Also, think about people that are from different countries. They might have different literacy levels,
Yeah.
and maybe reading isn't the most comfortable.
Yep.
And case in point, one of the reasons why we started SpeechMed, the origin story for the company all starts with Giselle. Giselle is our CEO's mother-in-law.
Okay.
She spoke French, but she spoke other languages. And she spoke English really well. She had a minor emergency, went to the hospital for signs of pneumonia, and after a couple of days, they sent her home. They said, stop taking these 2 medicines and start taking these 2 new ones,
Okay.
which was written in her discharge instructions. Well, instead, she didn't really read English very well, so she ended up taking all 4 of the medicine. It led to 16 weeks in ICU. She ended up passing away within 11 months.
Wow.
And if she went home with a device like SpeechMed, it would have told her in French when to take those medicines.
Yeah.
Her caregiver could have read everything in
Yeah.
English.
Yeah.
And so that's where we are. I would say we're addressing health equity in a different way.
Yeah.
Instead of a systematic way, we are addressing health equity through language and literacy. And these are skills that we can use digital technology to help patients.
Yeah. Yeah. That's that's a like a big impact. It's basically between a patient's life and death in a way.
Yeah.
If things go wrong, because the example that you gave,
Yeah.
right, which is crazy. So what's the impact that you see speech bringing in? Is there something like this already present?
I would say the impact is medical miscommunication, and medical miscommunication happens every 14 minutes. And it's a big um, liability for the organizations in terms of financial. It also hits them in some of their metrics
Yeah.
that they are, kind of regulatory metrics, but also from patient perspective and their families who wants to go through
Yep.
a medical mishap when going to a hospital or a health facility is one of their most vulnerable times.
Yeah.
So you want to equip them with the most way to empower themselves.
Yeah, that's amazing. So, uh, you know, uh, what are the languages that are supported today?
So in the Android version, we have English and Spanish, and we also will offer um, 6 other languages,
Okay.
and they are French, Italian, German, Korean, Mandarin, and Hindi.
Oh, wow. Okay. And is there an iOS app as well?
Yeah, it's currently in development,
Okay.
but the process to go
Yep,
through the
yep.
iOS store,
Yep.
but it will be releasing.
Amazing, amazing. So, in and all, you would be very soon supporting around 8 languages, as you mentioned.
Yep. And we're already thinking about 2 more that we would like to do, which would be Tagalog and Arabic.
Oh, wow. Okay. Okay. So, last couple of questions, right? What are some of the challenges that you faced overall while going through this whole journey?
Um, where do I start? I would say one of the first thing is just finding out who is the customer, right? We know that the user has to be the patient, but it's always who's going to pay for it.
Yeah.
And so it's been building or addressing the fact that not providing a service like this for the patients hurts the financial bottom line
Yep.
for the organizations. It also hurts them regulatory and also from a liability perspective.
Yeah. Yeah.
And right now there's a lot of conversation about health equity. And so using a product like SpeechMed would help you address some of the health equity metrics.
Okay. Okay. Great. And one of the final questions is about the purpose, right? So, what's the overall purpose of SpeechMed, and where do you see it going?
Um, there's so many different ways that we want to expand on SpeechMed. Our company is really good at the language and literacy engine that we've developed. And one area that we're going to actually develop or expand SpeechMed is into the colonoscopy area. So, if you know about the current colonoscopy process, colon cancer is, I think, the second most deadliest cancer in the US, but it can be prevented if a patient gets colonoscopy. And once they get a colonoscopy and you might detect polyps, the person's chance of living increases once they have a colonoscopy. So the colonoscopy process is very paper based. You know, pretty much the gastro center will give you a piece of paper and say, all right, here's your instructions, come back for the colonoscopy. Well, because of this, approximately 20 to 30% of colonoscopies are canceled at the last minute.
Oh, wow.
And this is because the patients don't prep themselves well for the colonoscopy. And it's very resource intensive for both the staff and it becomes expensive. So what we're doing is we are going to walk the patients with them through the colonoscopy process.
Amazing.
They will get instructions and alerts for when they need to start a low fiber diet, when they should, stop taking solid food and start a liquid diet, take the first medication regimen, second medication regimen, etc. And then there will be videos so that the patient, or multilingual videos, so regardless of your language, you'll be able to understand the colonoscopy process, the diet process. And what makes this really unique is that now that the patient will acknowledge that they've started the process, the gastro center or wherever the colonoscopy is going to be done, this is the first time that they will know exactly when the patient has started each of these different regimens.
Nice.
And they can be proactive and reach out to the patient and say, hey, it seems like you haven't followed the schedule. And this is to prevent any last minute cancellations that can occur.
Got it. No, this is amazing, and I think I have been talking to a lot of founders. This idea, is unique.
Thank you.
And definitely, as you are addressing it, and once I started learning more, I could really see. In fact, you said Hindi, right?
Mm-hmm.
If my parents are here, and they have an emergency, if they're even listening to something in a local language, that brings up a better confidence.
Sure.
To respond. Right?
Yeah, and especially now with a lot of home care moving to the home, and there's remote patient monitoring, this would be a great tool to help supplement that.
Great. So, thank you for your time,
No problem.
Jessica, and thank you for sharing all the details. I hope all of you guys also learned a little more about SpeechMed. And thank you for sharing the insights and being here at Health Tech Purpose.
Thank you. Thank you so much for giving me the opportunity to talk about SpeechMed.
Amazing. Thank you.
All right.